Are you preparing to take the TMC exam, or do you just need some extra practice when it comes to learning about pulmonary function testing? If so, you will find 35 practice questions in the exact format of the ones you'll see on the actual TMC exam, all covering the topic of pulmonary function testing. Each question contains the correct answer, along with a detailed rationale explaining why that answer is correct. This is definitely one of the most important sections of the TMC exam. With that being said, this information is definitely not easy for most students. This is not a reason to panic. It just means that you should certainly invest a lot of your time learning concepts of pulmonary function testing. The good thing is, the practice questions can help you do just that. So, if you're ready to boost your knowledge of PFTs and increase your chances of passing the TMC exam, let's go ahead and dive right in. 1. After reviewing the results of a patient's pulmonary function tests, you note that the FEV1, FVC, and total lung capacity are all reduced. The FEV1 to FVC ratio is normal. What is the interpretation based on these findings? A. Restrictive lung disease. B. Obstructive lung disease. C. Combined obstructive restrictive lung disease. D. The test is invalid. The correct answer is A. Restrictive lung disease. This is your typical PFT interpretation question. You will see a few of these on the TMC exam. And to get them right, you must understand what each value means in regards to knowing the difference between an obstructive and restrictive disease. Since this patient has a normal FEV1 to FVC ratio, this indicates that there is not an obstructive disease. Remember, the FEV1 to FVC ratio would be decreased if there were an obstructive disease present. And since the FEV1, FVC, and TLC are all reduced, this indicates that the patient has a restrictive disease. So, now that we've broken this one down, we can see that the correct answer has to be A. Restrictive lung disease. 2. While reviewing the patient's medical record, you note that the FEV1 to FVC ratio is reporting as being severely reduced. Which of the following is most consistent with this finding? A. Pulmonary hypertension. B. Morbid obesity. C. Chronic asthma. D. Pneumonia. The correct answer is C. Chronic asthma. To get this one right, you have to know that the FEV1 to FVC ratio is a measure of the percentage of a patient's vital capacity that can be expired in the first second of expiration. People with normal lungs can exhale at least 70% of their vital capacity within the first 1 second, which is the FEV1. When you see a reduced FEV1 to FVC ratio, that automatically tells you that there's an obstructive disease. And by using the CBABE mnemonic, we can see that only one of the answer choices could possibly be correct, and it's C. We dive deeper into CBABE and the obstructive diseases inside of our Hacking the TMC Exam video course. Definitely check it out if you're interested. But for this question, there is only one obstructive disease listed, so we know that the correct answer is C. Chronic asthma. 3. Your patient has an FEV1 to FVC ratio that is lower than predicted. Her forced vital capacity is also lower than normal as well. What is the most likely cause of these findings? A. A restrictive lung disease. B. An obstructive lung disease. C. Combined obstructive and restrictive lung disease. D. Normal test results. The correct answer is C. Combined obstructive and restrictive lung disease. Let's break this one down. The patient has a reduced FEV1 to FVC ratio, which certainly tells us that an obstructive disease is present. But they also have a reduced FVC as well. This tells us that they have a restrictive disease as well. So, combined, this patient has both an obstructive and restrictive disease. The correct answer is C. Combined obstructive and restrictive lung disease. 4. You are assessing a patient with chronic asthma. She has a slow vital capacity of 3,500 milliliters and a forced vital capacity of 2,500 milliliters. Which of the following best explains this difference? A. Increased compliance during a forced expiration. B. Poor instruction by the previous respiratory therapist. C. Muscle fatigue during a forced expiration. D. Air trapping during a forced expiration. The correct answer is D, air trapping during a forced expiration. The first thing that should stand out in the question is that the patient has asthma, which is an obstructive disease, and we know that air trapping is a commonality in obstructive diseases. If a patient has a significant difference between their slow vital capacity and forced vital capacity, this also indicates that air is trapped in the lungs when the patient exhales forcefully. Because the airways are obstructed or constricted, as with bronchospasm and asthma, all of the air can be expelled if the patient exhales slowly. It just takes longer. This explains why the values are lower with the forced vital capacity as compared to the slow vital capacity. None of the other answer choices really make sense in this situation, so we know that the correct answer has to be D, air trapped during a forced expiration. 5. What percentage of the forced vital capacity should a patient with normal lungs be able to exhale within the first second of the maneuver? A. 35 to 50% of the FVC. B. 50 to 70% of the FVC. C. 70 to 83% of the FVC. D. 84 to 93% of the FVC. The correct answer is C. 70 to 83% of the FVC. To get this one right, you simply have to know the normal range for the FEV1 to FVC ratio as a percentage. In general, patients with normal lungs should be able to exhale at least 70% of their vital capacity within the first 1 second, which of course is the FEV1. Patients with an obstructive disease will show a reduced FEV1 percent value, while patients with restrictive diseases will show a normal or sometimes high FEV1 percent value. The correct answer is C, 70 to 83% of the FVC. 6. Simple spirometry can be used to measure any of the following except A. Tidal volume. B. Vital capacity. C. Inspiratory reserve volume. D. Residual volume. The correct answer is D. Residual volume. A spirometer is a device that measures exhaled flow rates and volumes. It can be used to obtain measurements such as tidal volume, vital capacity, and FEV1. To get this one right, you have to know what residual volume is. Basically, it is the amount of air that is left in the lungs after a full exhalation. The residual volume cannot be exhaled, and because that is the case, it cannot be measured by simple spirometry. Tidal volume, vital capacity, and IRV all can be measured with a spirometer. You would need a plethysmograph, aka a body box, in order to measure the residual volume. This tells us that the correct answer has to be D, residual volume. 7. Upon the assessment of a patient receiving volume control assist control ventilation, you observe a flow volume loop with a sawtooth pattern on exhalation. Which of the following actions would help this patient the most? A. Switch to pressure control ventilation. B. Administer a bronchodilator. C. Increase the endotracheal tube cuff pressure. D. Assess the patient's need for suctioning. The correct answer is D. Assess the patient's need for suctioning. If you see a flow volume loop that shows an irregular sawtooth pattern in the expiratory portion of the loop, this likely means that there is some type of obstruction in the airway or ET tube. So, in this case, the best action to take is to assess for the need for suctioning. Auscultation would reveal rhonchi, and tactile fremitus over the trachea would confirm that excess secretions are present, which means that the patient needs to be suctioned. There's no indication to switch to pressure control, give a bronchodilator, or increase the cuff pressure, so you know that the correct answer has to be D. Assess the patient's need for suctioning. 8. Your patient is a healthy male with average body size. What would be considered the normal vital capacity range for this patient? A. 2,000 to 3,000 milliliters. B. 3,000 to 4,000 milliliters. C. 4,000 to 5,000 milliliters. D. 5,000 to 6,000 milliliters. The correct answer is C. 4,000 to 5,000 milliliters. The normal range for vital capacity is 4,000 to 5,000 milliliters, or 65 to 75 milliliters per kilogram. This represents about 80% of the total lung capacity. Normal values can vary significantly depending on the patient's age and sex. With that said, weight is not a factor in predicting normal values. To get this one right, you simply had to know the normal value range for vital capacity. For the TMC exam, be sure to know all of the PFT normal values. The correct answer is C, 4,000 to 5,000 milliliters. 9. The amount of gas that can be inhaled above the volume that is normally inhaled during quiet breathing is called what? A. FRC, B. ERV, C. IRV, D. VC. The correct answer is C. IRV. To get this one right, you have to know two things. First, you must know what the abbreviations stand for. I hope that you do at this point because you will need to know them for the TMC exam. And second, you have to know the definitions and differences between the lung volumes and capacities. If you do, then this one is super easy and you know the correct answer is C. The IRV, or inspiratory reserve volume, is the maximum volume of air that can be inhaled above the tidal volume after a normal, quiet inspiration. So, if you take a normal breath in, the air that you can breathe in on top of that tidal volume is the IRV. So that means we know that the correct answer has to be C, IRV. 10. After reviewing your work order for the day, you notice that you have a patient with chronic bronchitis and another patient with emphysema. Which of the following PFT findings would you expect for these patients? A. Increased lung compliance. B. Decreased forced expiratory flows. C. Decreased total lung capacity. D. Decreased diffusing capacity. The correct answer is B. Decreased forced expiratory flows. The first thing you need to interpret in this question is that both diseases that were mentioned are obstructive diseases. Now you can proceed through the answer choices and use the process of elimination to come up with the correct answer. We know that with obstructive diseases, the patient will have decreased expiratory flow rates. Their FEV1 percentage will be less than 70%. Air trapping is also common in obstructive diseases, which will cause the total lung capacity to be increased. A decreased diffusing capacity tends to occur only in emphysema. So, by using what we know about obstructive diseases as well as the process of elimination, you know that the correct answer has to be B. Decreased forced expiratory flows. 11. If you were to take the total of the maximum volume of air that can be exhaled from the maximum inspiratory level, this can be defined as which of the following? A. Residual volume. B. Expiratory reserve volume. C. Vital capacity. D. Total lung capacity. The correct answer is C. Vital capacity. To get this one correct, all you have to do is know the definitions and differences between the lung volumes and capacities. A lung capacity is a combination of different lung volumes. The question tells us that it combines the inspiratory volume and the expiratory volume, so we know that the answer has to be a capacity. That means we can rule out residual volume and expiratory reserve volume. The maximum amount of air that can be exhaled after taking a maximum breath in is defined as the vital capacity, which is the correct answer. In this case, the residual volume is the volume of air that remains in the lungs after a maximum exhalation. The residual volume is included in the total lung capacity, and since the residual volume cannot be exhaled, we know that TLC cannot be the correct answer. That means the correct answer is C, vital capacity. 12. Upon entering the patient's room, you heard the physician instruct the patient to inhale as deeply as possible and then blow out all of the air as hard as you can. Which pulmonary function test is being performed? A. IC. B. TLC. C. MVV. D. FVC. The correct answer is D. FVC. To get this one right, you have to know the PFT abbreviations as well as the differences between the different pulmonary function tests. When a patient takes a maximum inhalation, followed by a forced maximum exhalation, you should automatically know that this is a forced vital capacity maneuver, or an FVC as abbreviated in the question. That means that the correct answer has to be D, FVC. 13. The patient is instructed to take a deep breath in and then exhale as quickly as possible. The fastest air movement is recorded. Which of the following tests is being measured? A. Vital capacity. B. FEV1. C. MVV. D. Peak flow. The correct answer is D. Peak flow. To get this one right, you simply have to know what a peak flow is, because if you do, then obviously you would know right away that it is the correct answer. A peak flow, or peak expiratory flow rate, is defined as the fastest air movement during a forced exhalation and is measured in liters per second. None of the other answer choices fit the description of the test that is being performed, so you know that the correct answer has to be D. Peak flow. 14. You are instructing a patient on how to perform an FVC maneuver. After looking at the results of an attempt, you determined that it took too long for the patient to reach the peak expiratory flow. Before another attempt, which of the following instructions should you give the patient? A. Take a deeper breath. B. Don't hesitate. C. Blast the air out faster. D. Blow out longer. The correct answer is C. Blast the air out faster. The question tells us that it took the patient too long to reach the peak expiratory flow, which means that the patient simply isn't exhaling fast enough. This can cause invalid results. In this case, you should simply instruct the patient to blast the air out faster at the beginning of the maneuver, and this will correct the issue. Taking a deeper breath will not fix the issue, and the patient doesn't seem to have a problem hesitating. Blowing out longer isn't going to fix the issue either. So we know that the correct answer has to be C. Blast the air out faster. 15. Other than obtaining the results from a vital capacity maneuver, what else should be obtained and noted from the patient? A. The patient's resting minute ventilation. B. The patient's height, gender, and age. C. The patient's heart rate before and after testing. D. The patient's actual and predicted body weight. The correct answer is B. The patient's height, gender, and age. When performing a bedside vital capacity maneuver on a patient, you must obtain the patient's height, gender, and age as well, because these values are needed in order to compute the patient's predicted vital capacity value. It's also a good idea to know the patient's smoking history and current medications, even though they're not listed in the question or answer choices. The resting minute ventilation, heart rate, and predicted body weight are not needed at this time, so we know that the correct answer has to be B. The patient's height, gender, and age. 16. You're instructing a patient on how to perform an FVC maneuver. After looking at the results of an attempt, you determined that the back extrapolated volume is excessive. Before another attempt, which of the following instructions should you give the patient? A. Take a deeper breath. B. Don't hesitate. C. Blast the air out faster. D. Blow out longer. The correct answer is B. Don't hesitate. The question tells us that the back extrapolated volume is excessive, which means that there is a hesitation at the beginning of the patient's breath. This, of course, can cause invalid results. In this case, you should simply instruct the patient not to hesitate at the beginning of the forced exhalation. This will fix the problem. Taking a deeper breath will not fix the issue, and the patient doesn't seem to have a problem about blasting the air out fast enough. Blowing out longer isn't going to fix the issue either. So we know that the correct answer has to be B. Don't hesitate. 17. You have been monitoring the vital capacity and maximum inspiratory pressure readings over the last 4 hours of a 39-year-old female patient that is receiving mechanical ventilation. The values have steadily decreased over this time period. How should this be interpreted? A. Her condition is worsening. B. She has undiagnosed asthma. C. Her strength is improving. D. She is not giving her best effort. The correct answer is A. Her condition is worsening. For the TMC exam, remember that vital capacity and maximum inspiratory pressure measurements are valuable readings for determining if a patient is ready to wean from the ventilator. The patient needs to have an MIP of at least negative 20 centimeters of water pressure and a vital capacity of at least 10 milliliters per kilogram in order to wean. Since the patient's vital capacity and MIP values have been decreasing, this means that she is getting weaker and her condition is getting worse. Otherwise, the numbers would have been improving over the last 4 hours. None of the other answer choices really make sense in this situation, so we know that the correct answer has to be A. Her condition is worsening. 18. A comatose patient in the ICU is receiving mechanical ventilation. Taking this into consideration, which of the following pulmonary function tests can be performed on this patient? A. Peak expiratory flow. B. Maximum voluntary ventilation. C. Maximum inspiratory pressure. D. Forced expiratory volume in 1 second. The correct answer is C. Maximum inspiratory pressure. There is only one test in the answer choices that does not require any cooperation from the patient, so obviously, in order to get this one right, you have to have an understanding of each of these pulmonary function tests. A peak expiratory flow, MVV, and FEV1 all require an active patient effort, so we can eliminate those. That means we know the correct answer has to be maximum inspiratory pressure. An MIP can be performed by occluding the airway for a full 20 seconds and recording the pressure. This is a valuable reading to have in regards to knowing when to wean the patient from the ventilator. For the TMC exam, remember that the patient must have an MIP of at least a negative 20 centimeters of water pressure to be weaned. So, by using what we know about the different pulmonary function tests as well as the process of elimination, we know that the correct answer has to be C. Maximum inspiratory pressure. 19. The results of a bedside spirometry test that was performed on a patient reveals the following: a respiratory rate of 19, a tidal volume of 380 milliliters, a dead space of 145 milliliters, and a vital capacity of 1.1 liters. Based on these results, what is the patient's minute ventilation? A. 3.4 liters per minute. B. 4.7 liters per minute. C. 7.2 liters per minute. D. 21.3 liters per minute. The correct answer is C. 7.2 liters per minute. This is a very basic calculation and is something that every respiratory therapy student should know how to compute, and you should never miss this one on the exam. They did include some extra numbers in the question, just to try to throw you off. But you should remember that minute ventilation equals the rate multiplied by the tidal volume. So, in this case, minute ventilation equals 19 by 380 equals 7,220 milliliters per minute. Then you can convert it to liters per minute, which rounds to 7.2 liters per minute. So now we know that the correct answer is C, 7.2 liters per minute. 20. You are called to measure the strength of a patient's respiratory muscles at the bedside. Which of the following devices would you select? A. Pressure manometer. B. Peak flow meter. C. Ergometer. D. Respirometer. The correct answer is A. Pressure manometer. In order to measure the patient's respiratory muscle strength, you need to obtain an MIP or MEP reading, and to get this measurement, you can use a pressure manometer with a disposable mouthpiece. Remember, MIP is used to assess the possibility of weaning from mechanical ventilation. MEP is helpful in assessing the patient's ability to cough and clear secretions, which is also helpful in determining if it's safe to extubate the patient. None of the other answer choices can provide you with a measurement of the patient's respiratory muscle strength, so you know the correct answer has to be A. Pressure manometer. 21. A 56-year-old female patient's bedside spirometry results are as follows. The FVC is decreased. The FEV1 is normal. The FEV1 percentage is increased. What is the most likely problem? A. Normal results. B. An obstructive disease. C. Poor patient effort. D. A restrictive disease. The correct answer is D. A restrictive disease. This is one of the classic PFT interpretation questions that you definitely must know how to do for the TMC exam. The results of this patient demonstrate a classic restrictive disease because the flows appear to be normal or increased while the volumes are decreased. The FEV1 percentage is increased, so you know it can't be an obstructive disease, and clearly it's not normal results, or else it would say normal next to each of the results. This is clearly a restrictive disorder, so we know that the correct answer has to be D, a restrictive disease. 22. You are scheduled to perform a methacholine challenge on a female patient. What percent decrease in FEV1 needs to occur in order to conclude that a methacholine challenge is positive for airway hyperreactivity? A. 10%. B. 15%. C. 20%. D. 25%. The correct answer is C. 20%. To get this one right, obviously, you have to know what a methacholine challenge is, and you need to know the percentage decrease that must occur in the FEV1 in order to classify the airway hyperactivity as positive. The methacholine challenge is a test that assesses how the airway reacts or responds. It is normally used to diagnose patients with asthma. A 20% decrease in FEV1 is considered a positive result. Be aware that another name for the methacholine challenge is the bronchoprovocation challenge test. The correct answer is C, 20%. 23. Your patient has the following PFT results below. Vital capacity, 54% of predicted. FEV1, 76% of predicted. FEV1 to FVC ratio, 82% of predicted. Peak flow, 119% of predicted. Total lung capacity, 65% of predicted. Which of the following would be the best interpretation of the results? A. Restrictive disease only. B. Obstructive disease only. C. Bronchitis. D. Mixed restrictive and obstructive disease. The correct answer is A. Restrictive disease only. The first thing to look at is the FEV1 to FVC ratio. If it is decreased, then you know that an obstructive disorder is present. But in this case, it is greater than normal. The total lung capacity, on the other hand, is decreased. This right away tells us that there is a restrictive disease. Obstructive diseases cause air trapping, which causes the TLC to increase. In this case, since the TLC is decreased, we can conclude that an obstructive disease is not present. So that rules out the remaining answer choices, and we know that this patient only has a restrictive disorder. The correct answer is A, restrictive disease only. 24. You just obtained a peak flow measurement of 3.7 liters per second on a 39-year-old male who is 5 feet 9 inches tall. What is the interpretation of this test result? A. The patient has poor gas distribution. B. The patient has decreased lung compliance. C. The patient's peak flow is normal. D. The patient has an airflow obstruction. The correct answer is D. The patient has an airflow obstruction. The first thing you need to do is determine if the peak flow measurement is normal, high, or low. And to do that, you have to know the normal range. The normal range for peak flows in adults is 6 to 12 liters per second. So, clearly, this patient's peak flow measurement is below normal, which means that the patient has an airflow obstruction. The peak flow test does not assess lung compliance and has nothing to do with gas distribution, so we know that the correct answer has to be D. The patient has an airflow obstruction. 25. Using spirometry, you tested a 52-year-old female patient before and after a bronchodilator was given. The results show that her FEV1 increased from 62% to 83% of predicted. What do these results indicate? A. A fixed airway obstruction is present. B. The patient has normal diffusion capacity. C. The patient has a reversible airway obstruction. D. The patient has a restrictive process. The correct answer is C. the patient has a reversible airway obstruction. The first thing you should notice is that the FEV1 increased by greater than 15% post-bronchodilator. This tells us right away that the patient has a reversible obstructive disease, like asthma, for example. For the TMC exam, remember that the post-bronchodilator value must increase greater than 15% for the obstructive disease to be considered reversible. None of the other answer choices make sense in this situation, so we know that the correct answer has to be C, the patient has a reversible airway obstruction. 26. While performing an MIP test on a 19-year-old female patient, she produces the following results after 3 attempts. Attempt number 1, negative 23 centimeters of water pressure. Attempt number 2, negative 42 centimeters of water pressure. Attempt number 3, negative 14 centimeters of water pressure. Which of the following best explains this patient's results? A. There is a leak at the mouthpiece. B. The patient has an obstructive disease. C. The patient has a restrictive disease. D. The patient isn't giving a good effort. The correct answer is D. The patient isn't giving a good effort. In a case such as this, the patient's results are way too inconsistent. This tells us that she is giving a poor effort and not trying equally as hard on each attempt. This invalidates the results, so you can't make a determination about there being an obstructive or restrictive disease. And if a leak were present, all of the results for each attempt would be low. So we know that the correct answer has to be D. The patient isn't giving a good effort. 27. You are about to perform pulmonary function tests on a 52-year-old male patient. Before you begin, the patient mentioned that he smoked 3 cigarettes in the past 2 hours. Which of the following tests would be affected by this finding? A. FVC. B. FRC. C. RAW. D. Lung diffusion. The correct answer is D. Lung diffusion. By looking at the answer choices, you can determine that the FVC, FRC, and RAW would not be affected in the short term by cigarette smoking. So that means that the correct answer has to be lung diffusion. In a lung diffusion test, the carbon monoxide from the cigarettes would adversely affect the results. The correct answer has to be D. Lung diffusion. 28. Which of the following bedside measurements is considered to be the best for assessing the function of the respiratory muscles and mechanical properties of the lungs? A. Functional residual capacity. B. Vital capacity. C. Maximum inspiratory force. D. Minute ventilation. The correct answer is B. Vital capacity. To get this one right, you have to know and understand each of the answer choices, particularly vital capacity since it is the correct answer. A vital capacity is the amount of gas a patient can exhale after complete inhalation. It's a good way to test both the inspiratory and expiratory muscle strength, as well as lung compliance and airway resistance. None of the other answer choices can provide these measurements, so we know that the correct answer has to be B. Vital capacity. 29. A 29-year-old female patient with suspected asthma needs to undergo pulmonary function testing to confirm the diagnosis. Which of the following tests would be the least helpful in this situation? A. Lung diffusion study. B. Flow volume loop. C. Bronchoprovocation testing. D. Pre- and post-bronchodilator testing. The correct answer is A. Lung diffusion study. To get this one right, you have to understand the purpose of each of the tests that are listed in the answer choices. If you know this, you can easily select the correct answer. A flow volume loop, bronchoprovocation test, and pre- and post-bronchodilator test are all very helpful in diagnosing asthma. That means that the least helpful is a lung diffusion study. A lung diffusion study test measures the carbon monoxide diffusion, which can in turn evaluate oxygen diffusion. This is not particularly helpful in diagnosing asthma. So, by using what we know about PFTs and asthma, as well as the process of elimination, you know that the correct answer has to be A. Lung diffusion study. 30. While reviewing the results of a forced vital capacity maneuver of an adult male patient, you note that an S-shaped curve appears on the flow volume graph. This most likely indicates which of the following? A. The patient stopped exhalation too soon. B. The patient was coughing during the attempt. C. The patient was breathing too fast during the attempt. D. The patient gave poor effort at the start of the breath. The correct answer is D. The patient gave poor effort at the start of the breath. After a patient performs an FVC maneuver, if you see an S-shaped curve on the flow volume loop graph, this indicates that the patient gave a poor effort at the start of the breath. If you think about it, it's an S shape because the flow starts out low with poor effort, then it increases in the middle of the maneuver and then plateaus toward the end of the breath. None of the other answer choices really make sense in this case, so we know that the correct answer has to be D. The patient gave poor effort at the start of the breath. 31. You are about to perform a pulmonary function test on a 65-year-old male patient after providing a bronchodilator breathing treatment. It is suspected that the patient has COPD. His results are as follows. He has an FEV1 to FVC ratio of 64%. He has an FEV1 of 86% of predicted. How would you characterize this patient? A. Normal. B. Mild COPD. C. Moderate COPD. D. Severe COPD. The correct answer is B. Mild COPD. Irreversible airflow obstruction is present when the FEV1 to FVC ratio is less than 70% of predicted after a bronchodilator is given. However, the patient's FEV1 is greater than 80% of the predicted value. This tells us that he is in the mild stages of COPD. If the FEV1 would have been less than 60% of predicted, it would be classified as moderate. If the FEV1 would have been less than 40% of predicted, it would be classified as severe COPD. But, since it was greater than 60%, we know that the correct answer has to be B. Mild COPD. 32. Your patient is about to perform a maximum expiratory pressure test. Which of the following instructions should you give to the patient? A. Take a normal breath in, then blow out hard. B. Inhale as much as you can, then blow out hard. C. Exhale normally, then inhale as hard as possible. D. Blow out all of your air before you begin. The correct answer is B. Inhale as much as you can, then blow out hard. To get this one right, you must know what an MEP test is and how to perform it properly. A maximum expiratory pressure test measures the output of the expiratory muscles against a maximum stimulus. It is a test that can check to see if the patient is ready to be extubated. If the patient can generate a maximum expiratory pressure of greater than 60 centimeters of water pressure, this is an indication that they can clear secretions on their own and extubation can be recommended if they meet the other criteria. But back to the question. In order to get the best results, you should have the patient inhale to total lung capacity, then blow out as hard as possible. None of the other answer choices include the correct instructions, so that means the answer has to be B. Inhale as much as you can, then blow out hard. 33. A 54-year-old female patient's spirometry results show an FEV1 that is calculated to be 80% of her forced vital capacity. This finding suggests that the patient probably has which of the following? A. Chronic bronchitis. B. Emphysema. C. An obstructive lung disease. D. Clinically normal values. The correct answer is D. Clinically normal values. This one is simple to interpret. This patient's FEV1 to FVC ratio is normal because she exhaled a normal percentage of her vital capacity in the first second. If the patient had an obstructive disease, the percentage would be decreased. So that rules out the remaining answer choices and tells us that the correct answer has to be D. Clinically normal values. 34. A 49-year-old male patient has a vital capacity of 3,400 milliliters, a functional residual capacity of 4,600 milliliters, and expiratory reserve volume of 1,400 milliliters. What is his residual volume? A. 8,700 milliliters. B. 2,100 milliliters. C. 3,200 milliliters. D. 5,800 milliliters. The correct answer is C. 3,200 milliliters. You may see a calculation such as this on the exam, but don't panic. This is a very simple calculation. To get this one right, you must know that the FRC is equal to the residual volume plus the expiratory reserve volume. You can use the lung box to remember this. We share our strategy about the lung box inside of our Hacking the TMC Exam video course if you're interested. You can get access on our website at respiratorytherapyzone.com/hacking. So using the same formula, just rearranged a bit, it also means that the residual volume is equal to the functional residual capacity minus the expiratory reserve volume. So now we can plug in the numbers. 4,600 minus 1,400 equals 3,200 milliliters. By performing simple subtraction, we calculated that the patient's residual volume is 3,200 milliliters, which means that the correct answer is C. 35. A patient performs an FVC maneuver and displays the following results. How would you interpret this flow volume loop tracing? A. Normal lungs. B. Small airway obstruction. C. Large airway obstruction. D. Restrictive disease. The correct answer is D. Restrictive disease. You will most likely have one of these flow volume loop tracings on the exam, so you will need to know how to interpret them. Not to worry, we break it down for you inside of our Hacking the TMC Exam course, if you're interested. But in general, you can remember this rule of thumb. For restrictive diseases, the loop will appear tall and skinny. For obstructive diseases, the loop will appear short and wide. This one is tall and skinny, so you know that the correct answer has to be D. Restrictive disease. And that wraps up our practice questions on pulmonary function testing. I truly hope that these questions help you study and learn the information necessary for you to ace the TMC exam when that time comes. People often ask me, what's the easiest way to pass the TMC board exam on my first try? I always give the exact same answer. You practice. It's that simple. You've spent months in the classroom learning all the material and information you need to know for the exam. Now, you just need to practice answering questions exactly like the ones you'll see on the actual exam. If you liked the practice questions and found them to be helpful, then I have good news. This is only a small sample of what we have for our students. You can check out our TMC test bank, which is loaded with over 1,000 practice questions and explanations, just like the ones here. The good thing is, we cover each and every topic that you must know for the TMC exam, including more questions on pulmonary function testing. If you're interested, just go to respiratorytherapyzone.com/TMC. That's respiratorytherapyzone.com/TMC. I wish you the best of luck as you study and prepare for the TMC exam. Keep practicing and working hard, and I know you'll be successful as you take the exam and begin your career as a respiratory therapist. Thanks again, and as always, breathe easy, my friend.